Hi everyone, myself Ms. Manisha K, Assistant Professor cum Neuroscience Technologist from the Department of Neuroscience in Yenepoya School of Allied Health Sciences, Yenepoya deemed to be university. Today I am here to present on the topic cerebrovascular disease. Let's begin with specific learning objectives. At the end of the session, students will be able to define the stroke, explain in detail about the classification of stroke, describe the causes, pathology, investigations, risk factors, and treatment of various stages of stroke. To begin with definition, cerebrovascular disease can also be called as stroke. They're actually defined as if you see any abnormality in the brain, basically it results from the pathological disorder of blood vessel or artery. In other terms, brain disease occurs secondary to the pathological disorder of blood vessel or blood supply, which is nothing but the primary suspect of the stroke is pathological disorder of blood vessel or the arteries. Moving on to the stroke, it has been classified into two types, ischemic stroke, hemorrhagic stroke, and ischemic stroke is further classified into transient ischemic stroke. Of all the strokes, 80% is due to ischemia, 15% is due to hemorrhage, and 5% is due to transient ischemic attack. So this is the picture which clearly shows all three types. So here the first picture denotes ischemic stroke, where you can see obstruction of the blood vessel because of the presence of blood clot due to the atherosclerotic plaque. And the second picture which denotes the hemorrhagic stroke, where you can see a rupture of blood vessel and you can see the bleeding inside the brain. And the third picture is nothing but transient ischemic attack, which is also called as mini stroke, which is actually caused by temporary clot. Now I'll be discussing about the classification of stroke in detail. Type 1 is the ischemic stroke, which is nothing but you will see a reduction of blood flow either due to the occlusion or obstruction, in other terms blockage of the blood vessel. As you can see in the picture, there are three types of ischemic stroke: embolic, thrombolytic, and lacunar stroke. So in this picture, it is clearly mentions about both embolism and thrombosis. Embolism is nothing but, as you can see in the picture, there is a blood clot in the blood vessel which is not just staying at one place, it is getting dislodged from heart to the brain, which means it gets moves from the one area to the other area. Thrombosis is nothing but it is a blood clot in the blood vessel which is actually formed by the atherosclerotic plaque. And the third one is the lacunar stroke, which is nothing but these are very small arteries which are present deep within the brain, which is caused due to the reduction in the blood flow. And moving on to the causes of ischemic stroke, it has been divided into two types, occlusion and embolization. So before discussing about the occlusion, I would like to talk about the three factors which affects the embolization. So number A is diseases of the blood, example coagulopathies, hemoglobinopathies. B, cerebral venous thrombosis, which is nothing but you can see thrombosis in the cerebral vein because of it's due to infarction, infection, dehydration, postpartum, or oral contraceptive pills. And the last category is decreased cerebral perfusion, which is why? Because you'll have a reduced blood flow as well as oxygen level to the brain, and it also leads to infarction. So now let's move on to the occlusion. It is again further classified into atheromatous and non-atheromatous. Atheromatous, where you can see a plaque, a fatty deposits in the blood vessel, where non-atheromatous, that will be not seen. So when it comes to atheromatous, it is further classified into three types: large vessel occlusion, branch vessel occlusion, perforating vessel occlusion. So let's explain that in the pictures. The first picture is the example for large vessel, and example for large vessel is carotid artery, where you can see the occlusion of blood clot as well as the fatty deposits in the carotid artery, which is basically present in the neck region. And the second picture, which denotes the branch vessel occlusion, example is middle cerebral artery. You can see a beautiful sclerotic plaque as well as the blood clot in the branching vessel. And the third picture is the example for perforating, which is lacunar. As explained before, there are some holes in the brain MRI scan. So when it comes to non-atheromatous diseases, it has been again, those are the examples: collagen disease, vasculitis, granulomatous vasculitis. Moving on to the embolization, it is again further classified into three categories. Number one, as I explained before, it is nothing but you can see a lot of plaque as well as blood clot which actually dislodge from the aortic arc to the brain. And the second one, heart, you can see a lot of disorders there. So if you see these pictures, these are the causes of embolization. The first one is valvular heart disease, which is nothing but any valve of the heart is getting damaged or diseased. The second picture is cardiomyopathy, where the muscle of the heart, which is nothing but myocardium, is getting diseased or damaged. And the third picture is endocarditis, where you can see clumps of bacteria getting accumulated on the surface of heart. When it comes to the third category, which is miscellaneous, it is further classified into fat embolism, air embolism, and tumor embolism. Fat embolism is nothing but that is the picture where it shows the blood vessel which has been accumulated with the fat globules in the blood supply. And air bubbles will be seen in the blood vessel, as well as in the tumor embolism. Those are the orange ones are the tumor cells. Those will be translocated from the necrotic region and it get deposited in the arteries, causing occlusion. So now coming to the signs of the stroke, there is a famous mnemonics which is B fast for stroke. B stands for balance, E for eyes, F for face, A for arm, S for speech, and T for time. So what are the signs which actually stroke patient experiences? The number one is loss of balance, loss of vision, face drooping, arm weakness both in upper limbs and lower limbs, slurred speech, and T stands for time to call an ambulance. Moving on to the symptoms. The symptoms are hemiplegia, hemiparesis, which is nothing but the paralysis of one side of the body which affects the arms, legs, facial muscles of the one side of the body. Hemisensory loss is the alteration of sensation in the one side of the body. Aphasia is the language disorder in which person will be having difficulty to understand and communicate the spoken language. Dysarthria is the difficult to articulate, impaired consciousness. Vertigo is nothing but spinning or dizziness. Ataxia is the loss of motor coordination. Cranial nerve dysfunctions. Cerebellar signs are nothing but nystagmus, tremors, ataxia, etc. Bowel bladder incontinence and apraxia. Now let's discuss about the risk factors. It has been subdivided into three categories: major, minor, ischemic modifying factors. When it comes to major, the symptoms are hypertension, smoking, obesity, and minor oral contraceptive pills, hereditary hyperlipidemia, increasing cholesterol level, alcohol, coronary heart disease. Ischemic modifying factors are hypotension and decrease in glucose levels. What are the investigations? CT, MRI, ultrasound, digital subtraction angiography, carotid Doppler, transcranial Doppler, magnetic resonance angiography, magnetic resonance venography. Here the picture denotes transcranial Doppler, where sound waves are actually sent to the brain, which helps in detecting the flow of the blood in the brain. The most important aspect of our topic is the treatment. So let's discuss treatment in detail. There are so many measurements actually given for the ischemic stroke as a treatment. The number one is thrombolysis. It is called as clot buster medicine. So the medicine used for thrombolysis is alteplase. It is given by injection, which basically dissolves the blood clots and restores the blood flow to the brain. Alteplase is very effective and should be given within 4.5 hours. The second treatment is thrombectomy. It is actually given when the blood clot is present in the large arteries of the brain. Basically, this is the picture where it shows the catheter is inserted into the blood vessel or the artery, and then there is a small device again which is passed through the catheter into the artery. How the blood clot is resolved? So here the blood clot can be removed either by using a device or through suction. The first picture shows suction. The second picture shows the breaking of the clot into the small pieces and removed. And the third treatment is aspirin. As we all know, it is a painkiller and it is also an antiplatelet. The role of antiplatelet is nothing but to reduce the chance of another clot forming. Other than aspirin, in the further stages, clopidogrel and dipyrimidine is given. And the fourth treatment is anticoagulant. So some people may be offered an anticoagulant to reduce the risk of developing new blood clots in the future. So as you can see in the picture, there are so many anticoagulant drugs. So among that, heparin is given for short term, and other drugs like warfarin and etc. they are given for the long term purpose. So the next treatment is the statin. As you can see in the picture, the statin is basically used to reduce the level of cholesterol in the body, which is the major risk factor for the stroke patients. So how does it reduce? It goes and blocks the chemical or the enzyme which is present in the liver that produces cholesterol. And the most important treatment when it comes to surgical intervention is carotid endarterectomy. The picture clearly explains how it happens. So basically this carotid artery is present in the neck region. The surgeon will basically do a cut or incision in the neck region to remove the carotid artery, and as well as to remove the yellow color thing is the atherosclerotic plaque. We have to remove that and then make sure the carotid artery is placed in its position and stitched back. Yeah. So when it comes to the management, the most important point to be remembered is golden hour. So the golden hour for stroke patient to be admitted in the emergency ward or neuro ward is 3 hours. So within stipulated time, within this 3 hours, the patient should be admitted, otherwise it will lead to severity. So next classification we are going to explain in detail is hemorrhagic stroke. So what is the definition of hemorrhagic stroke? It's nothing but, as you can see in the picture, there is a rupture of blood vessel where the blood is bleeding into the brain. So where does it get drained into the brain? Either into the parenchymal tissue or in the subarachnoid space. So moving to the causes of hemorrhagic stroke, the first cause is the hypertension. The next one is amyloid vasculopathy. It is nothing but the accumulation of amyloid in the cerebral vessels, and aneurysm is the ballooning of the artery. The next cause is the arteriovenous malformation. Neoplasm is nothing but the tumor of the cancerous cells. Next cause is coagulation disorder. The example is hemophilia. Anticoagulant therapy, vasculitis, drug abuse, example cocaine, trauma. Till now we were talking about the definition, classification, investigation, treatment of the stroke. Let's move to the pathology of the stroke. Now as you can see in the picture, that is the blood vessel with 3 layers: tunica intima, tunica media, tunica adventitia. The inside the cavity present is the lumen. So intima is the endothelial line which plays a major role and important barrier to leakage of blood and constituents to the vessel wall. So how does this atherosclerotic plaque develops? So basically it damages the inner layer, which is intima. So intima is the important barrier to the leakage of blood and constituents into the vessel wall. So how does this atherosclerotic plaque develops? It basically damages the endothelium lining, which is nothing but intimal layer. So what does this atherosclerotic plaque consist of? Intimal cells, smooth cells, which consist of cholesterol, lipids, phospholipids, collagen and elastic fibers. So what happens in the process of atherosclerosis? So in the first picture, it beautifully shows that plaque is forming in the lining of the artery. So as this plaque grows, the lining of the artery becomes weak and damaged. So this lining of the artery breaks, which means in other terms ruptures, and the plaque comes out of the layer. Then as the plaque comes out of the layer, it forms the thrombus, in other terms called blood clot, and also it reduces the blood flow. So that is how atherosclerotic plaque is being formed. So here the hemorrhage may occur within the plaque. Yeah, it can occur within the plaque, which is the yellow ones, or the plaque may ulcerate into the lumen of the vessel, forming the intraluminal mural thrombus. So here the last picture shows plaque along with the thrombus. So it is present in the luminal region. So that is why it is called intraluminal mural thrombosis. So either way, the lumen of the involved vessel is narrowed or blocked. Narrowing is otherwise called stenosis. Blockage is otherwise called occlusion. As you can see in the picture, the first one is the normal one where the blood flows easily. The second picture shows there is a deposits or cholesterol buildup seen in the lining of the blood vessel. So there is a very reduced flow of the blood. The last picture is a complete obstruction of the cholesterol that actually stops the blood flow. Hemorrhage may continue to expand beyond the first few hours due to continued bleeding. But when it comes to 48 hours, the blood and the plasma around the brain, it basically causes the disruption of blood-brain barrier. And also you can see cytotoxic edema, and you can see neuronal damage and also necrosis that leads to infarction. So hematoma basically resolves within 4 to 8 weeks, but it leaves the cystic cavity, as you can see in the MRI scan. Moving on to the symptoms. Symptoms of hemorrhagic stroke are classified into 3 types based on the location: supratentorial hematoma, cerebellar hematoma, pontine hematoma. The symptoms which comes under supratentorial hematoma are headache, loss of consciousness, hemiparesis, third nerve palsy. Third nerve palsy is nothing but there are so many arteries in the circle of Willis, which is the blood supply of brain. Among that, posterior communicating artery, posterior cerebellar artery, superior communicating artery will actually experience aneurysm. And the symptoms which comes under cerebellar hematoma are headache, severe ataxia, vomiting, dysarthria, nystagmus, vertigo. So the symptoms which comes under pontine or quadriplegia, where you can see paralysis of all four limbs, respiratory irregularities, pinpoint pupils, disconjugate eye movements. What are the investigations of hemorrhagic stroke? CT scan, angiography CT, MRI, MRV, MRA. Moving to the treatment of hemorrhagic stroke, it involves surgical intervention. The first one is craniotomy, where the surgeon will cut the skull and remove the bone, and will also repair all the damaged blood vessels and ensure that there are no blood clots present that may restrict the blood flow to the brain. So after bleeding has been stopped, the piece of the bone which is removed from the skull is being placed back by using metallic plate. The next treatment is surgery for hydrocephalus. So the main complication of hemorrhagic stroke is hydrocephalus. Hydrocephalus is nothing but accumulation of CSF fluid, cerebrospinal fluid in the ventricles. So which actually experiences a lot of symptoms like headache, sickness, drowsiness, vomiting and loss of balance. So what happens when CSF fluid is accumulated in the ventricles? How do we drain it? We put a tube called ventriculoperitoneal shunt, which is placed inside the ventricles and which drains the CSF fluid, and it drains into the peritoneum. So the last type, which is the subcategory of ischemic stroke, is transient ischemic stroke. These are just episodes of focal neurological symptoms due to the inadequate blood supply to the brain. So these are actually called mini stroke, as it is only for temporary time. These are reversible, sudden in onset, they resolve within 24 hours and leave no residual deficit. So these attacks are important as these are warning episodes or precursors of cerebral infarction. And coming to the pathogenesis, it is the same as ischemic stroke. Number one is reduced blood flow through a vessel or blockage of passage by embolism. So moving on to the classification, TI is being divided into two types: carotid territory, vertebrobasilar territory. As you can see in the picture, the yellow part, which is anterior side, which is carotid territory, and the blue ones, which is the posterior side, that is called as vertebrobasilar territory. Coming to the carotid territory, the symptoms are hemiparesis, dysphagia, monocular blindness. So the person experiences blindness, fogging, dimness in one of the eyes. And when it comes to the vertebrobasilar territory, the symptoms are loss of consciousness, binocular, where both the eyes are affected, tinnitus, the patient experiences ringing or other kind of sounds in any one of the ears, diplopia is double vision, and dysarthria. What are the investigations of TIA? Doppler, which involves both carotid and vertebral, echocardiogram, CT scan, blood glucose level, angiography. Risk factors are age, hypertension, diabetes, atrial fibrillation, hyperlipidemia and smoking. Let's conclude our presentation with treatment, which involves antihypertensive, anticoagulants, antiplatelets, osmotic regulators, mannitol, surgical intervention, endarterectomy. So let's summarize our topic. Stroke can be defined as those in which brain disease occurs secondary to the pathological disorder of blood vessels or blood supply. As we all know now, there are two types of stroke: ischemic, hemorrhagic, and transient being the subdivision of ischemic. So etiologies are thrombosis, embolism, hemorrhage. When it comes to treatment, it is thrombolysis, thrombectomy, anticoagulants, antiplatelets, surgery which involves endarterectomy, and management, as we all know, golden hour for the stroke patients to be admitted, it should be before 3 hours. So these are my references, and thank you.